From GP surgeries to hospitals to the NHS app to cancer care. Some of the services NHS England made sure were provided to the public. Now all this will be put back into the hands of the Department of Health and Social Care. Today's announcement has taken everybody by surprise, not least, you can imagine, the people working behind these windows at NHS England headquarters here in central London. On Monday, there was an announcement that there were going to be job cuts, but nothing to say that there was going to be an out-and-out abolition of the organisation. So now the Health Secretary will have to explain, not least how it's going to work, and also how it is going to help patients get that operation they need or see the GP they want. The Prime Minister's speech was about slashing regulation and slimming the civil service, or in other words, a bonfire of the largest quango in the world.
I can't, in all honesty, explain to the British people why they should spend their money on 2 layers of bureaucracy. That money could and should be spent on nurses, doctors, operation, GP appointments.
In 2012, the former Health Secretary, Andrew Lansley, set up what was to become NHSE as part of hugely controversial and unpopular reforms. Reforms described as so big you could see them from the moon.
Hi, how are you doing?
But go back a bit further to this man, Alan Milburn, also once a Health Secretary, now back in the Health Department and widely held to be behind this unexpected and bold decision.
Where's Streeting?
Today, the Health Secretary described the abolition as the final nail in the coffin of those disastrous reforms.
Over the next 2 years, NHS England will be brought into the department entirely. These reforms will deliver a much leaner top of the NHS, making significant savings of hundreds of millions of pounds a year. That money will flow down to the front line to cut waiting times faster and deliver our plan for change.
So I'm Amanda, hello.
The Chief Executive of NHSE, who is leaving along with a raft of senior figures, presumably because they did know their jobs were on the line. Now the question is, will the remaining staff keep their eyes on those waiting list targets? How will it, for instance, improve patients' access to GPs?
In the short term, I can't see how it will. It might improve clarity about who's in charge at a national level over time. It might improve clarity of accountability at a national level. It might reduce some duplication. In the short term, though, it might distract leaders from implementing changes to improve access to general practice, to improve access to hospital service, to address the massive problems that we see every day in the NHS.
Work is to begin immediately on returning some of the NHSE functions to the Health Department, reducing the overall headcount by 50%. And there's a promise too that this will give greater control not to Mr. Streeting, but to local organisations, and that there will be an end to excessive targets and box ticking. Well, it really did take many by surprise. Now, I was speaking to some people who might have known on Tuesday, and this was certainly not on their radar. But now we're being told that it was under discussion for the past couple of weeks with those between those at the top, and it was kept absolutely secret. I was even told maybe there was a code word used. Now, I don't know how true that is, but one insider told me that every day they'd expected it to leak because, frankly, most other big announcements have leaked under this regime. Now, the Health Service Journal, often the recipient of these leaks, hadn't heard anything, to the relief of Mr. Streeting's team. Yet, talking about the HSJ, it was only on January the 31st that Wes Streeting told them that there would be no merger. So this has moved very quickly. What next? Well, answers we need. How do you dismantle NHSE without huge disruption while keeping to your pledges of getting waiting lists down? Will it save the money that was suggested today? How much duplication will remain? Mr. Streeting, again, will appear before the Health and Social Care Select Committee before Easter, where he will be grilled on all of this. One thing we do know, though, is that most of it can be done without legislation. Just the final abolition will need to go through Parliament, and that will likely be supported. There is cross-party support for this. And we will have a very different looking NHS within 2 years.
Thank you, Victoria MacDonald in our newsroom there in London. Well, our political editor, Gary Gibbon, is in Westminster. Gary.
You get some interesting insights into the politics of all of this, depending on who you're talking to in government. As you heard in Victoria's report, Keir Starmer, number 10, they're emphasising this is an attack on knotweed, on the quango state, and it's going to save money. Not a great deal of money in the great scheme of NHS expense, but that's what they're focusing on. Talk to people in the Department of Health, and they talk about how this is part of their great vision of public sector reform. Yes, they are going to, as Victoria said, grab some powers from NHS England as they get rid of it, but only to give them back to the trusts. And they say this is a template for public sector reform which worked with academies, and they can make it work here. And interesting that, as you saw in Victoria's report, Alan Milburn is at the middle of it all. It's seen as good Blairite stuff by those people who like the reforms of Tony Blair's third term. Talk to people in the Treasury and you get an interesting different spin on all of this. For years, people in the Treasury, there's been a deep resentment that they felt that NHS England was covering up its homework, hiding the numbers, the true numbers from them when it came to negotiating what the NHS should actually have from the general kitty. They didn't trust NHS England, and they didn't trust them when it came to briefing either. They were convinced at the last budget that NHS England went off and briefed the media that 22 billion wasn't going to be enough, wasn't going to do the job, and they really resented that. I'm told Wes Streeting resented it quite a bit as well. And they feel that NHS England were repeat offenders. So in the Treasury, they're popping champagne tonight and pleased, very pleased about all of this. One other bit of the politics, all of this, if you can find, you keep finding Tory MPs who are also absolutely thrilled about it. They say, I wish we'd done more of this stuff. Yet again, Keir Starmer popping up in a bit of the political spectrum you wouldn't quite expect him to be.
Gary Gibbon in Westminster. Well, I've been speaking to the Health Secretary, Wes Streeting, and I started by asking him what had happened to that promise of no top-down reorganisations of the NHS.
What I've experienced in the last 8 months is that across the Department for Health and Social Care and NHS England, the head office of the NHS, is a lot of brilliant people, really brilliant people, but set up to fail with waste, inefficiency, duplication, sometimes competing small p politics, organisational office politics, and a combined size that is double what it was when Labour left office in 2010, delivering the shortest waiting times and the highest patient satisfaction in history. So it's one of the reasons we are paying more and getting less. And the changes the Prime Minister and I are announcing today will deliver better outcomes for patients and better value for taxpayers, saving hundreds of millions of pounds that can be redeployed to the front line. I've built a one-team culture in the last 8 months. Now the Prime Minister's announced one organisation, and in doing so, we're abolishing the biggest quango in the world. But
it is a major reorganisation of the way the NHS works, and you know, you haven't really wanted to do that, or you said you wouldn't do that, and won't now thousands of people working in NHS England spend the next 2 years trying to work out whether they've still got a job? They will not be focused on the NHS, they'll be focused on themselves.
No, and look, the first thing to say is I recognise that with any change like this on this scale comes disruption and consequences for individuals, and I am acutely aware of that. The prize is enormous, which is not just hundreds of millions of pounds saved that can be deployed to the front line, but a more streamlined, effective way of working that ends this fallacy that you can just sit there in Westminster and Whitehall firing enormous numbers of instructions into this vast system, assuming that's how you deliver change.
But a sceptic might say, you know, politicians go to reorganisation and bureaucracy when they don't have a big idea for themselves. When are we going to get your big vision for the NHS, and when is it going to deliver? When are we going to see the fruits of getting rid of NHS England beyond the speech?
We've come in with a plan. We are working to it step by step, week by week, month by month. And then we'll later this year, around either just before or just after the spending review, set out the 10-year plan for health, which will set out the longer-term direction. This, what we've announced today, is part of that trajectory. So a much smaller, more effective, streamlined centre, doing the things that only we can do nationally, delivering value for NHS providers across the country, but giving far more power to communities, close to communities, to local leaders, and crucially to patients.
I mean, this is a big sort of in-principle change away from the arm's-length body that wasn't controlled by politicians to saying, no, the health secretary is in charge, he's the man we will blame if things aren't working. Now, that sounds appealing in one way, but couldn't it also create a bottleneck? Couldn't it? And it could also create an over-politicisation of things because, first of all, every big decision is going to become risky and will end up being knocked up to your office. And secondly, you'll be taking decisions around services and hospitals in political constituencies where there are political decisions to be made as well. How are you going to guarantee that you will not over-politicise the NHS?
It's a fair question. I think the guarantee is that we will end the over-centralisation. So what we're creating is a much smaller national organisation doing the things that a national organisation should do. I think the other reassurance I want to provide is that clinical decisions about services and how care is delivered, the science behind it, the methodology, that must be led by clinical leaders. In the last 8 months, I've had lots of decisions come to my desk where people are saying, interfere in this reorganisation, interfere in that reorganisation. And I haven't interfered in a single one.
But if it comes to closing services or opening a new hospital, that's going to come to you, isn't it? Because that's a massively political hot potato.
I mean, it already has. I mean, if you look at the new hospitals programme, that is a mess that I had to roll my sleeves up and sort out with the team.
How will hospitals then be held to account? Because at the moment, it's NHS England that does that.
Yes, and there'll be two ways effectively. The functions of NHS England will come into the Department of Health and Social Care. There will still be a chief executive of the NHS and clinical leaders based in the department. We're just reducing the bureaucracy around it. And we're reforming the Care Quality Commission, which is meant to be the patient safety regulator effectively, which has been in a total mess. It's got new leadership now. So that's how you guarantee quality and recognising that there should be consistent standards everywhere, even if services necessarily look a bit different in different parts of the country to meet the needs of local communities.
Wes Streeting, thank you very much indeed.
Thanks a lot.